COVID-19 is continuing to spread around the world, with 158 million confirmed cases. I'm joined today by the WHO country representative in Kazakhstan, Dr Caroline Clarinval, to discuss what the year of pandemic has been for Kazakhstan and for the globe. Thank you, Dr Clarinval, for joining us today. So it's been a very unprecedented year for the globe and for Kazakhstan as well. How would you describe what the year has been since the outbreak of the coronavirus infection?
Thank you very much for having me. It's a pleasure to be here with you today. And indeed, 2020 took everyone by surprise. Even though WHO has oftentimes tried to remind member states that there might be a disease outbreak one day of this sort of event. At the same time, none of us were well prepared, and member states as well. In general, they were quite taken by surprise. So 2020 was unprecedented, as you said, in many forms and ways. It was a difficult year, but also a year in which we have been able to demonstrate that science matters, that health matters, and that when making a global effort, we can support one another and make sure that we can overcome a crisis like this. Kazakhstan has always been very keen on trying to learn what other governments are doing, what other member states are doing, what are the measures that they are implementing, in order to make sure that the measures that are applied and adopted here in Kazakhstan are as up-to-date or as appropriate as needed. Very quickly last year, WHO has promoted a certain set of public health and social measures, right? Like what we do today, we wear masks, we maintain physical distancing, we just cleaned our hands, we make sure that we are in a well-ventilated space. Allows us that these measures are being implemented by governments and adopted by the people. These measures go along with the vaccines that are also being developed now, and they show that there's quite an interesting interplay between what the science tells us about this virus, what the healthcare workers and health specialists tell us on how we can protect ourselves, and how then governments play an important role in making sure that the people know, first of all, what they have to do, that healthcare infrastructures are being well equipped and able to cope with the sick, and that all the knowledge that we have is being shared. So last year was, when we look at all the things that we have learned, a fascinating year in that sense, right? So as a globe, we were confronted with an outbreak that was unprecedented. We rallied in many forms and ways in order to overcome this crisis. And what I try to underline here is that despite all the difficulties that came with this outbreak, despite all the sick and the numbers of people we have lost, at the same time there is a positive narrative regarding all the efforts that were made by the individuals, by the organizations, and more particularly by the governments and such as ministries of health and other social institutions of a country. And in that sense, I think it's always important that we remind ourselves all the efforts that we have put into finding ways on getting out of this crisis. And here, I think 2020 has taught us a lot, and I still reflect on it on a daily basis, trying to also learn for myself, trying to see how WHO can better support the Ministry of Health now here in Kazakhstan particularly, and how I can also better care for my little family and how I can better care for my colleagues at work.
Mm-hmm. So you mentioned that the government is playing a very crucial role in addressing the outbreak. So how would you assess the response of Kazakhstan to the outbreak in general?
So the heavy lifting in a response like this is definitely done by the government, okay? And every government, I mean, because they were taken by surprise and because they had difficulties, they had to find ways on how they could adjust to this. They were, for Kazakhstan, they were particularly looking towards other countries. In this context, we were benefiting a bit from time. So initially, China got heavily hit, and then Europe got heavily hit, and then only in a later stage was Kazakhstan confronted with an increased number of cases. And they were, in the meantime, always trying to do the best in order to prepare themselves to respond to the needs that were coming up. So there was a very strong outlook towards how do governments or countries that are being affected by this crisis respond to this? How can we here in Kazakhstan respond to this best? So very quickly they have also increased their capacities in terms of hospital beds. They have built facilities. They have made sure that the healthcare workers are being trained. They have mobilized resources. And WHO has played a role in the sense that we try to provide the technical expertise in some of these areas. I also believe that the government very quickly has tried to inform the population regarding how, for example, what are the essential measures that they have to take. They have sort of also adjusted the public health measures according to the epidemiological situation. They have then developed the red light system in order to see, okay, where is the virus? So in that sense, they very quickly started an increased number of testing of patients in order to understand where the disease is, which communities are affected most, and how can we make sure that they are the best protected. And I think in that sense that was a very helpful tool, and people were quickly informed as to what they could do in order to protect themselves. So there was this dual role of informing the population, giving them the means to find a way on how to deal with this, and what are the measures they can take in order to seek either healthcare services when they're needed because they're sick, or to look after their family members, or to make sure that they don't get infected. And at the same time, they were putting an enormous emphasis on reinforcing and building the capacity of the healthcare system, which is an enormous effort if you look at it.
Indeed. And what are some of the ways the WHO has supported Kazakhstan in addressing the outbreak and continue to do so?
So WHO has very quickly come up with a number of key areas of intervention. One of them, for example, is coordination. Coordination, there was one role that I took up, trying to liaise a lot with the Ministry of Health, but also with the other agencies of the United Nations and embassies and the international community. So we were trying to coordinate not only our response, but also making sure that there is no duplication of efforts, and that because in times like these, coordination is quite important. So that was one role. Then WHO also did a lot in terms of risk communication. We have increased our outreach in social media. We have posted hundreds of posts. We have received over 500,000 of views, which in the end is still a small proportion, but nevertheless it's way more than what it was at the very beginning. So there was a constant increase in trying to make sure that the right information is being made available. We could also see that we try to share the most, up-to-date information, right? And make sure that people have access to the appropriate information that is based on the latest evidence. So in that sense, I believe communication was really key, trying to reach out to the people, letting them know what they can do and what they should do, etc. At the same time, so there's then this particular thing about WHO where we do lots of we have a lot of technical expertise. What does that mean? So we work in areas that are not necessarily well known to the public. So colleagues of mine, they have put an enormous amount of effort into what they call infection prevention control measures. So that means that they provided training to doctors and nurses, teaching them how to make sure that they know how to wear their protective equipment, how they engage with patients, how they make sure that they protect themselves from getting infected, how they make sure that patients are not being exposed to this. So that is an important area of work, which was in the past, oftentimes, it's part of the health system, but it's often sort of a bit neglected, and it was globally neglected, right? So WHO has, at the global level, put an enormous amount of effort into trying to share the latest expertise and latest knowledge there. So we've tried to share that with the healthcare workers. They have also done this in Russian, and we have adopted also important information material into Kazakh to ensure that the population has access to it in their language, which I unfortunately don't speak, but we've tried to make sure that people access the knowledge. Then also in terms of case management, that means what are the protocols that need to be put in place in order to allow the doctors to treat the patients according to WHO's guidelines. So Kazakhstan has made an enormous effort in trying to adapt the WHO guidelines to Kazakhstan. So the treatment protocols here are in line with WHO's guidelines, and that is amazing. But these things happen in the background, right? We can't see them. But it's people putting a lot of thought and a lot of effort into making sure that those protocols are as good as they are, or that they're up to date to what evidence and science tells us today. Then we have a young team that looks after laboratories, right? So everybody has had a PCR test. Very few of us knew what a PCR test was before. So we have supported the Ministry of Health in increasing their capacities in terms of PCR testing. We have also visited some laboratories. We have assessed the quality of the laboratories here in Kazakhstan, which are actually very good. The laboratories function well. The testing capacities have been increased. And these things are really important and very, very valuable as well. But again, it's something we don't see on a daily basis, right? So we have also made sure that in terms of logistics, some of the medical equipment is being flown into Kazakhstan. We have also worked with other countries and other donors in order to mobilize these supplies. Maybe an important point is WHO is a knowledge-based organization, right? So as knowledge was being developed and built over the last few months, WHO has established this academy and these courses called Open WHO. In Open WHO, you can learn a lot, and all that information is available for free online in English. But many, many courses have been translated into Russian, and 7 courses are currently being translated into Kazakh. So here as well, we try to make sure that the knowledge that we gain is being shared and made available for all. Because this is what this is about, right? So we are all in this together. We need to find a way on how we can make the appropriate solutions and available for all. So there is this website called Open WHO where you can learn heaps. So for all of those that are interested in learning something about COVID-19, please feel free to look it up.
We mentioned that raising the awareness about the importance of how not to get infected among people is a crucial key to addressing the outbreak. But we see the cases rise since the beginning of March in Kazakhstan, and people still continue to neglect the very important social distancing, mask rules. How can we address this issue? I mean, how can we motivate people to follow the rules?
We have seen that the entire world has seen an increase in what they call waves of COVID cases. These increases of cases are multifactorial. Responsibility that we have as individuals to not forget to, for example, keep physical distancing, to wash our hands, to wear our masks when needed, to stay in well-ventilated rooms, to sneeze in our elbow when we have to, etc., are fundamental. Okay. Yet at the same time, we are human. There are situations where all of a sudden there will be an increase in number of cases. Okay. What we have learned is that most of the cases are mild or moderate. Okay, and they can be treated at home. What is important then is what we call the surveillance. So we have to very quickly identify the case, we have to very quickly test them, and we have to very quickly also test their contacts, just to make sure that these people are isolated at home and that they stay there, that they're being looked after, that they're being taken care as well at home, because they don't need to be necessarily admitted to a hospital. Okay, so we have the entire population that is being treated and taken care of at home, and at some point they will test negative, and then they can go outside again. Some of them might experience some long-term COVID-19 health consequences, but they can be monitored as well in the future. But then we have the population that is severely or critically ill, and these are the ones that need urgent hospital care and attention. And those are the ones that are at risk of dying. And those are the ones that we have to put in most of our efforts as well, in order to make sure to give them the best of chances to survive. So many of them will need oxygen supplies. Some of them might need to be ventilated, etc. And the problem is that once they have been ventilated for a prolonged period of time, it will then take them probably quite some weeks or months in order to recover fully, right? So we have the situation of the people are falling sick, and then at some point they have to recover. And we have to remember that recovery is also important. And what we can also see is that, for example, besides the typical symptoms of COVID-19, particularly, for example, now respiratory distress, many of them also have mental health issues or become a bit depressed. It's something that has been shown as a side effect of the disease. And that means that as a society, we need to put systems in place that can help them overcome this, right? We could see that overall the situation here in Kazakhstan is that despite this increase is sort of controlled, and this is due to the behavior of the individuals, but also a health system that is capable of taking care of the ones that need their support.
It's been more than a year since the outbreak, and what else do we know about the virus? And another important issue, should we be concerned about the new variants that is currently reported around the world?
So what we know about the virus is that it's a virus that is being transmitted by droplets through someone that has symptoms and is coughing or sneezing, essentially. And yes, we have observed that there is a new variant. There's variants of interest and variants of concern. It's interesting that the scientists, they've put an enormous amount of effort into sequencing the virus, right? And now worldwide we can track how this virus, which was an original virus, is mutating. The fact that it's changing is nothing unexpected, because this happens as you are in contact with people. The more people the virus gets in contact with, the higher the probability that at some point it will change a bit. So WHO and many other scientists, they are looking into these variants. They're monitoring the variants. They're looking at how are they evolving, because some variants, they might be more infectious, others less infectious. They might have lead to greater risk of mortality or lesser mortality. So they're doing a lot of analysis and a lot of monitoring. So it's really important that governments join forces and share data. So the other important point here is that because we're in this all together, the more data we can collect, the more data we can analyze, the more we will learn. We are still learning a lot about the original virus, about the new variants of interest or of concern, and how they affect us. These analyses allow governments to then set up new measures or to recommend new measures for the people to adhere to. Okay? Some then all of a sudden, depending on the rise in cases and the capacities in the hospital, etc., they might decide to reduce freedom of movement and to go into lockdowns. Others, because the situation is more stable and better, they can open up. So what is important is that we base these decisions on science. And that's the message. It's really important also for Kazakhstan that we keep a very close view on the epidemiological situation, on the numbers of cases, that we ensure an appropriate contact tracing, that we ensure that the surveillance of this is done well, in order to know where the virus is, and in order to know how quickly does it transfer from one person to the other, in order to then tell the people, look, please make sure that you maintain, that you're extra cautious in your daily encounters.
Since the outbreak, it's been noticeable that all the news, all the agendas seem to be focused on coronavirus, but there are still plenty of other non-communicable diseases that are still existent, but it seems like less attention is now paid to them. And if you could tell us about that and about the work of the WHO in this area as well.
That's an excellent point, and indeed it's often when there is one topic that moves the world, everybody looks into that direction,
Yes.
whereas there are many other issues that affect us still just as much. Regarding WHO, so it is an organization that develops norms and standards for many diseases, for many healthcare interventions. And also, all of those, we also look at non-communicable diseases such as cardiac diseases, diabetes, mental health, and pulmonary diseases, as well as cancers, right? Non-communicable diseases, they affect the world in a very high proportion. So many of the people that fall sick or that die because of one of those communicable diseases. And that's why it's really essential that we still put an effort in making sure that people don't smoke, that people reduce their salt intake, that they reduce the intake in fats as well as in sugars, right? We also have to continue making an effort in making sure that people have access to physical activities, and that they just make healthy choices. But it's very difficult to make a healthy choice when you are in a situation of a pandemic, right? So again, it all comes down to the human, and how do humans make choices? Which choices, do they know which ones are the healthy ones, right? First of all, do they have access to all the information? So WHO supports member states in sharing that expertise and the science behind it, so that also ministries of health can then inform their populations as to how they should behave in order to live healthy lives. In Kazakhstan, for example, we have a large health promoting programs in schools, trying to also inform the youth and the children in making the appropriate choices for them. We also look after the health of mothers and children more generally. We still get involved in immunization programs. One of the key activities for WHO is to support the health system, right? And for example, digital health is something that Kazakhstan has invested in a lot of efforts. And here as well, we can share the expertise that we have gained globally, and we can work with and support the Ministry of Health in Kazakhstan in that area. For example, in areas such as mother and child and adolescent health, in areas such as digital health, we work closely with them. In areas such as mental health, there is a very close collaboration here. We also work at all the 3 levels of the health system, like the primary health care, which is key here in Kazakhstan due to the Almaty Declaration, and the system that your country has developed and is promoting. Then also the secondary and the tertiary care levels. So we look at issues such as antimicrobial resistance, such as emergency medical services, such as tuberculosis and HIV, such as nutrition in general, vaccinations, violence and injury prevention programs, etc. So we look at the system in its entirety, right? And we look at the health for all people. So from birth to death, right? All of them are equally concerned. And the aim that we have is to actually ensure that people have access to quality healthcare services in a timely way.
Yes.
Right? And so whatever it is that we learn at the global level, we try to support Kazakhstan and we share that knowledge with Kazakhstan in order for Kazakhstan to make the appropriate adaptations to the local context. There is a number of initiatives that we are launching, that we are supporting, that we are engaging with the government to allow the government to adjust this to here in order to make the best of use of the science that is available at global level, or the science that we discover here, because we also do some research projects here, and these findings are fascinating. One interesting area of work, for example, is behavior insights. So we try to understand the behavior of people in order to make sure that we tailor our recommendations accordingly. And in that sense, so these are all important areas of work. And overall, so what we are here to do is we bring our services, we put our knowledge to the service of the Ministry of Health and the people of Kazakhstan. So, and at the moment, I think we play, I hope, an essential role, or at least a helpful role, looking at the current ongoing crisis.
I really like the point that you brought up about mental health and the importance of addressing it, particularly amid the outbreak of the infection, because it is usually the case in the society that people do not pay sufficient attention to these issues, and they seem to think that they can overcome them by themselves, and they do not seek any professional help. And there is also another issue of stigma against about these people who seek professional help, and I think that's a very important point that you also mentioned.
Yes, mental health it's once you have a mental disease, or once you have an anxiety, or you feel depressed, it's something that is so invisible that it's very difficult for people to, first of all, understand what is going on, to then accept that they're not well somewhere else than a broken leg or broken arm, and to then very quickly ask for help. This also requires that the health system is capable of providing that help. So that help needs to be made available, and people need to know whom to turn to. So it's a very difficult situation whereby people, they need to learn that it's okay to ask for help when you're not well, irrespective of your age, irrespective of your gender, irrespective of your status. I think it's really important that we also look after one another and our families, because sometimes people that are not feeling too well, they might not let others know. So we have to pay particular attention to the well-being of our family members as well as our colleagues or co-workers. And these are moments like today where not only the government and the health systems are being tested, we are all being tested. We're all being tested for our resilience. We are being tested for our empathy. We are being tested for our ability to support and help. And we are being tested for our flexibility and many, many other things, right? And here, I think now we can show to the world that we are intelligent people, and that we can also develop that level of intelligence and emotional intelligence and sensitivity in going towards others and making sure that they feel well as well. Just reassuring, making sure, are you checking in with them? Are you okay? And not just asking the question like of the goals, but really showing interest. And people initially, oftentimes, they will not necessarily come forward, but with a bit of tact and a bit of effort, you might at least get a glimpse of how a person feels. Because these are difficult moments, and particularly when someone has lost a family member, it's okay to acknowledge that it's hard. It's okay to acknowledge that we have been hurt, and it's absolutely perfectly fine to ask for help, and to not necessarily have to go through this alone, because there's a lot of people that are very willing to help. Particularly Kazakhstan, you've got a wonderful social system. You've got extended families that are there to help. In our cultures, it's a little less like that, so we feel maybe a bit more isolated. And yes, I've had to learn to ask for help. And I've noticed that in life, whenever I've asked for help, a lot of people were actually offering an amazing support. So please, people, look after one another, seek help when needed, and I'm sure you'll find the appropriate care required.
Thank you for joining us today, Dr. Clarinval.
My pleasure. Thank you very much for having me.